Hello. You want to say hello?
Hello.
What are we doing?
Heading to Mufi's vet appointment today. See what's going on.
We're gonna go see what's going on with Mufi's leg. You guys know that we've run into a few issues with it. His future was, well, to me, I guess, was looking pretty uncertain. And I'm hoping to be able to slowly but surely put him back into work again. But he was so excited to put that vest on. Oh, by the way, do you see a anxious dog? Do you?
No. Nope, nowhere to be found.
Is prongs cruel?
Not that I know of.
If you don't know how to use them right, yes, I can see how they can be cruel. But if you learn how to use them right and you learn like leash pressure with it, they're totally fine. They don't actually hurt the dog. And in fact, it's quite the opposite for him. He gets very excited when he sees his prong come out. So keep that in mind. Now, I don't know how much video I'm going to be able to take at this appointment. It's probably going to be all audio. So, yeah, we are taking him to Rose something?
Rose Veterinary Hospital.
Rose Veterinary Hospital. The last place that we were going to take him basically canceled the appointment on their own. So, that's a whole different story time in itself.
Yeah, so we're going to a new vet clinic.
New everything. The vet that Mufasa, should I say is or was? The one in Boulder.
I would say was.
Okay, the one that his care was under, the vet person thing is in Boulder. We live in the middle of absolutely nowhere, like mountains.
We're at the opposite end of the state.
Yeah, so I think it's probably a good thing that we decided to go with a different place, one that we can get closer. We do actually have pet insurance on him. We still have to pay for the appointment, so that's...
Yeah, it's got a deductible with it.
After that, it should be just fine. So, we will see where to go, and like I said, you guys may not have a whole lot of video in this video, but you will have audio. So, let's see where we're going. Yeah, well, I've got my notes and everything, so... Those out for them. Oh, do you need some of this? Okay. Where's my notes? I just had them. Oh, sorry. No, I'm not nervous.
Like a cockroach in a pest control convention.
98 pounds.
Yeah.
He's a lot heavier than what I thought he was. Get some x-rays maybe? He's a whopping 98 pounds. I'm gonna see what we can do for you. You can tell he's nervous. information that they want?
Usual name, address, phone number, pet's name, what?
Mufasa. I was like, no, this girl's name's Mufasa, not Mustafa. What's that?
Age 43.
4.
Date of birth.
9/9/2019. No, 9/10. I'm sorry.
I don't know what this microchip number is.
Oh, I can call them different information.
Yeah.
My hair is doing. Guess what? He is on leash.
He's veterinary hospital.
Previous one was in Forward Humane Society.
Here at Rose Veterinary, we love to celebrate our patients and share pictures on our website and social media channels. Do you authorize us to use photos of you videoing?
Just follow my socials back. Yeah.
This is the same.
What are you doing, bud?
You sniffing out all the dog smells? Yeah, I know. There's another puppy too. Hello.
Who's that?
Is this Mufasa?
Yeah. Hello.
What's in here? Oh, here. Alright, so we can
Movie. Stop.
Movie.
Stop it. Stop.
When did the plane happen that she hurt the back leg?
Okay, say that one more time.
So it says that he's playing with a Great Dane,
His
and then that's when she hurt the back, or he hurt the back leg. Sorry.
we live on a back alley.
Okay.
Okay, it's a house, back alley, train tracks. Okay, they were both off leash, just running around, and they ended up colliding with each other. And ever since then, he does have a previous knee injury that we are aware of. That doesn't. I don't think that has anything to do with this. If that makes any sense.
Okay.
Ever since they collided, he has been limping moderately, but pretty severely.
It depends on the day. Sometimes it's pretty severe. Sometimes it's not.
Okay, but it's always pretty very present.
It's very present, yes.
Yeah, he was on the treadmill and stuff to lose his weight.
And I do have a couple of things that my trainer wanted me to bring up as well.
Okay.
Just so you know, everything that's on the counter right now is what he's taking.
Okay.
I forgot the buffered aspirin that he takes, but he takes 2 buffered aspirin every morning.
It's fair.
Yeah. Okay?
Yeah. I think your best is fine.
No, you want to make a fight. No. Quit being obnoxious, please.
He wants to go say hi.
I know it does.
I don't know what to do.
And has it gradually gotten worse, or has he improved any since that accident happened?
He's improved some, but it's still.
Okay, I just want to make sure it hasn't gotten worse since it's happened.
So a couple things. Is this all on?
As far as I know.
Okay. I'm working under a trainer for service dog training for him. A couple of things that she wanted me to bring up is the possibility of a knee x-ray for him, just to make sure that that's okay. We did find out that he is pretty severely allergic to chicken. How do you explain the swelling that comes with that?
I don't know.
He balloons, like
All over?
all over, yeah. And unfortunately, the chicken, when he balloons, makes the limping a lot worse.
Well, yeah, because the water's in the joint.
Yeah. We are very much aware that he is overweight. He is currently on 5 minutes at a speed of 3 on a treadmill. He is on a diet food. He gets low-calorie treats, which he doesn't get many of. And we did at one point have him down to 55 pounds from 115. The trainer pulled him from PA work at all. This is the first time he's had his vest on in
Months.
Yeah. He gets 2 Consequin in the morning, which we did find helps quite a bit. We were gonna do 10-minute trips with him,
Are
but
you going to record this, or are we?
it's already on.
Okay. Wasn't sure.
No, it's already on. I'm recording it for my trainer.
Oh, you're good.
Yeah. We were going to do 10-minute trips, but we realized that in order for me to get to the closest store is about half an hour away. So we decided to not do that. He also ends up getting a bloody spot on his belly. I don't know what it is. I have no idea what it's from.
It's
It's like a mole slash.
looks like it's a bleeding wart, is what it really is.
Yeah.
And how is that present all the time? Is it?
Yep.
Do you,
Roll
mind,
over.
do you mind if I take him off leash so I can tell you?
Go ahead.
Mr. Nemu.
Okay, come on. She's gonna
Right there. And it just kind of like will break open and start bleeding.
Go flat, Moon.
You're okay.
Yeah, it's, like I said, it looks like a bleeding wart, because I have something similar.
Yours is on your tummy too, isn't it?
Mhm.
Okay. Do you care if he makes a friend? Make a friend. Still gotta get that one paw out.
Yep. We'll have to make an appointment for that, huh?
I'm gonna remind myself to do it.
Yeah.
I did find out that there was one more, but when I went to go and look at the ingredients on it, the first ingredient in it is chicken. So I'm like,
What diet food does he eat? Like is it lamb or
like it's lamb.
It's lamb and rice. It's
Diamond Naturals, I think. Diamond Natural. It's one of the
yeah, it's diamond.
gold bags.
I just wanted to know what kind he was on since he ain't getting chicken. We allowed him to get chicken he was taking on.
Yeah.
Are you done?
No.
No, I'm not gonna take it out right now.
No.
You're wild.
Yeah, I know. You haven't been out in so long and you don't know what to do with your own puppy. Huh. No, you don't.
And then how old is he? Because they have 4. Okay.
He is.
They accidentally put 40. And that's what I was saying. I wonder if they're trying to put 4. So that's why I was like, I want to double just make sure that they accidentally put that 0 in there. So
If he's 40, I'm calling Guinness World Book.
I would too, because you are handsome. All right. Well, then I would.
Sparky for 40, aren't you?
That's true.
What? Oh, I know. You're
I'll go
fine.
ahead and let the doctor know what's going on and just kind of relay everything, and we'll come in here.
What
and
about his
check it out.
ears?
Oh,
Check out his
the other thing is, I do dog grooming. So part of dog grooming, what we learned is if something irritates a dog, it's usually something
Oof.
like yeast,
Just stay there and
habits,
behave.
something along that line.
Just stay there and behave.
Well, he had a whole
No.
bunch of like ear hair, and when I went to go and pull that out, there was a whole bunch of yeast on the bottom of it. So I have been cleaning his ears out, which has been working very well, but
Are you in there?
shaking really bad or scratching at his ears really bad at all?
if you let him.
Especially this
We can
one.
definitely check his ears and everything.
Isn't
I
it
just wanted
this
to
one
see
that's
if
worse?
he's getting after him really, really bad at all.
Again, it depends on the day. If it's a day that
Yes, sir. All right.
if it's a day that I'm cleaning his ears, he usually goes after it, but it's because it's a cleaning liquid.
Right.
So it's
ours, yeah.
So that,
Excuse me.
and then there's other times where he'll leave him alone, and then others where he just won't. Like he does his own
There you
like
go.
thing.
Good boy. That's a good boy.
Oh, I told you I was gonna get you
Well,
up
then,
there.
I'll go ahead and get her, let her know what's going on. We'll come in here and check him out, get that leg checked out and everything that
Okay.
your trainer did me and stuff, and give it to you, okay?
Okay.
Thank you.
Put him down as 40. Is that what she said?
Mm-hmm.
40.
Yeah.
Oh shit, I called Guinness Book of World Records too.
She has a Mandalorian tattoo on her forearm.
Does she?
Mm-hmm.
You were the only one that would notice that.
I
There was-
didn't have a chance to ask her what clan she was. She thought she was in.
It's funny because the one who's like, go train your service dog, you know, Daddy Zuko or whatever. And I was like, no. You know, I was watching one of his videos earlier and I noticed he has a Jack Skellington tattoo on his hand. I'm like, that had to have hurt. That had to have.
Yeah. Well, I have a tattoo that I would like. It's not exact, but I don't know if I can find the right one.
Well, like I said, I explained everything to you,
Mm-hmm.
and
Yep.
I gotta pee.
Well, pop out the door and ask him where the bathroom's at.
Are you gonna be okay with just him?
Yeah. Mom's gonna go do a puppy, okay? She'll be right back.
Do you guys have a restroom I can use? You're fine. Stay with Daddy.
Oh my God. Yes, you're staying here. Come over here and sit the heck down. Come on. Between my legs. Hey, come here. Down. All the way. Yeah, you're fine. You're fine. I know you have anxieties. Yeah, you have separation anxiety with mom. I know you do. Mm-hmm. Mm-hmm. Hello. I'm not too bad.
Good. My name's Dr. Gina. We've got Mufasa here.
Yeah.
And we've been.
He's
Limping a
upset.
little bit.
Mom left to go to the bathroom.
Oh,
so
no.
he's upset.
Bubba, it's gonna be okay.
Yeah. She'll be back in a minute.
Alright, so we are mostly here for our leg, but we also have a little wart on our belly and then our ears. Is that right? Okay. Well, we'll just do a full physical exam since we haven't seen you before. How's that sound? Are you just people waiting?
Yeah.
Ready?
Gotta watch that tail. His sister's even worse.
Are ya?
Yeah. Because her tail's longer. She has more reach on it. Mm-hmm. Yep.
Yeah.
Unlike his sisters, our little beagle took it in the teeth. Well, it started out with her being abused by animals, and then she tried to play tug of war with a rope with these guys.
Oh no.
Yeah. You can behave, yes you can. You're being loved on. It's your favorite thing.
And where's the wart on her belly? Is it this guy?
Yep, that's
okay.
it.
Come on, there's Mom.
What happened?
I went to bend over and clean off the toilet, and my hair landed in the toilet.
Oh no. Come here, Mufasa.
Okay, right.
Lie down. Lie down.
That's okay. Look.
Look at
There you go. Pull that off.
I just pulled a little bit of it off, yeah. So I think it was a little bit of a scab. I don't think it was anything, which is good.
Well, that's the second time that's come back.
Okay.
So you're aware.
Okay, that's good to know.
Good boy.
Mm-hmm.
Yeah. So I guess my kind of rule of thumb is we monitor it, and if it grows in any way, shape, or form, then we kind of do more radical things like taking it off. But just with that little tiny bit, it doesn't look worrisome to me right now. But if it continues to come back and he starts bothering it and doing all those bad things, then I think it would be worth kind of looking into further. All right, dude, can I feel your legs while you're like this? What do you think?
It's his back right. Swollen. He's not usually that big. Good boy. I know. He had to get me some treats.
You hear me better? Yeah, I'm gonna give on some treats for you. I
You're
know.
okay. What's
Yeah.
in your eye? Give me that.
Hmm?
This is the most treats he's gotten.
I am having a good time.
Oh.
Okay, so you're rolling around the other side? Okay.
You really have a look at the other one? Huh?
What do you think, Bubba? You're doing so good.
I know.
Right now. Good boy.
Did you wash it?
I have to. I didn't have time.
Good boy.
Yeah.
We're going to go over his care a lot. Yes, good. Yes, good. Yes, okay.
Concentrate on the move, honey. Not there.
It's freaking disgusting. Now I feel like I gotta wash my damn hair.
Probably, but
He's hesitant on that one. Okay, I know. You're
So I'm not feeling any crunching or sliding, which is good. I might just have him trot down the hallway and back. Do we have a leash for him? Or?
oh yeah.
We do. How much will it
That should be funny.
be? Ready? You're gonna go doggy down the aisle. You ready?
So with me, if you want to just step out, all the way down on my back.
You want to sit there? Oh, he's limping a little bit.
Is there air out there?
He's limping a little bit there.
Yeah. You He's just rolling around on the hard floor, and then
I don't know why I gave that to you.
I have no idea what you're doing.
I don't know either. Is he doing okay?
Good.
Mookie. Watch, today's gonna be one of his better days. Of course. Of course.
It's the same way with the owlie cat.
So he has moderate amount of muscle atrophy, and I do see the limp. It's probably like a grade 2 lameness in that right hind. Are these all the things that he's taking, I presume?
Yes.
Okay.
We did find out that he does have a chicken allergy.
Okay.
He swells.
Okay.
Bad.
Okay.
One of the things that he was taking for his calmness, ended up having chicken as the first ingredient.
Of course. Okay.
And I wasn't paying attention to it.
Oh,
so
okay. Yeah.
as of yesterday, that he knows that. Not
Okay.
me.
Yeah.
But yes,
Okay.
he takes 2 Cosequin a
Okay.
day.
Okay.
And 2 of the aches and pains one a day. And the calm and the pheromone spray are used as needed.
Okay.
basis.
Okay.
Okay, and then 2 buffer aspirin.
Oh yeah, the 2 go for aspirin too.
So aspirin is a little controversial in vet med, and I don't know if you've heard this from anyone else before. There's safer medications that we can give them that are proven, and we know that it's not going to kind of shut down their liver and kidneys. I'm more on the proponent of not doing aspirin at all, just because of the scary things that I've seen it do to dogs, and it doesn't do it to everyone, and that's why it's controversial that no one's kind of landed on it. That's for sure. Yes, that's super bad for dogs, or no, it can be helpful.
I found it to be helpful.
Okay, yeah.
So yeah.
No, yeah, and it probably does help, but I'm just worried about his kidneys and liver function, because we don't know about that. So, so just looking at him in general, teeth look great, heart and lungs sound great. He is overweight, so
We are aware of that.
okay. So what is our diet currently? What do we eat?
Right now, let me just clarify something. I am working with a trainer.
Okay.
Obviously, you can see.
Yep.
I am working with a trainer, and right now, we didn't want to push him because we didn't know what the leg was about. So, right now, he's doing 5 minutes on the treadmill at a speed of 3.
Okay.
1 cup of food a day.
Yeah, 1 cup of food a day.
Total.
Total.
Okay.
Like, he only eats in the morning.
Okay.
He doesn't, sometimes he'll eat at night. Like yesterday he was like going after his bowl,
Okay.
and that tells me that he's still hungry. So on a very rare occasion he will get 2 cups, but
Okay.
again, on a very rare occasion.
Okay.
So there's that. We are aware that he's overweight. He's doing the 5 minutes on the treadmill because we didn't know about the leg. He is on a lamb and rice diet food.
Okay.
He is on, what is the name? Diamond Naturals.
Okay.
Thank you. And obviously he's trained to be a service dog. We have switched his treats from canine carryouts to those.
Okay.
These are, I think, 3 calories.
And about how many of those does he get a day?
He's gotten more today than he
Well,
has.
yeah, but like in a normal day.
4 or 5.
Yeah.
Okay.
Can you get that?
Sometimes what we can do is use their actual diet as
Thank you.
as the treats. And the other thing I'd be worried about.
I've already tried that.
Okay.
Yeah.
The other thing I'd be worried about if we are going serious
I
with the
see.
diet and he's not getting anything else, no table scraps, no nothing, no anything else, would be hypothyroid. Sometimes he could be eating 2 kibbles a day and still be gaining weight. So if we,
He is a black mouth pig, so I think that's part of it.
right, but they're not supposed to be overweight like that. I mean, breed does play into it a little bit, but
I know,
his
you're dripping
weight-
everywhere.
His weight shouldn't fluctuate too much,
Enough.
and
That's enough.
just mobility wise and health wise and all the things.
So just so you're aware,
Yeah.
we're going to take him to a different vet, and they were aware of all of this. They
Okay.
know that he is a service dog in training. My trainer pulled him from PA altogether.
Okay.
This is the first time he's worn his vest in months. The other vet that I talked to pulled him from mobility altogether.
Okay.
So right now, as it stands, he doesn't do a whole lot of anything.
Okay.
He goes for a walk every day.
Yeah,
Yeah.
that's about the extent that he can handle at the moment.
I know, huh?
He's a good boy.
Okay. Yeah. So I mean, so has the other vet ever tested him for anything like hypothyroid or anything like that? 'Cause
No,
that could be.
they canceled the freaking appointment on us.
Oh. Okay.
Yeah.
Okay.
So, yeah. We're gonna be coming here from now.
Needless to say, 4 Mile lost a good patient, I would think.
Yeah, I
You know.
appreciate him as a patient. That's for sure. He's a very nice boy.
The other thing is, we did, at his heaviest, he was 115.
Okay.
At one point, we had him at about 55 pounds.
Okay.
So, he's lost the weight before,
Yeah.
and he's looked really good
Okay.
before.
Okay.
We are working on getting him down again.
Yeah.
So,
Yeah, because I was gonna say like 60 would probably be his goal weight. I wouldn't want him obviously too skinny, but he definitely, for mobility reasons, could lose some weight. And I don't know about if your trainer does anything with like hydrotherapy, because that's really helpful. Low impact joints.
we are, I'm planning on getting a pool.
Okay, yeah, that would be really helpful for him. So.
I'm gonna get it for him in particular.
Yeah, yeah.
Don't get me wrong, my 2 girls, my
I'm sure they love it, yeah.
my Great Dane mix and my Beagle mix could benefit from it
Yeah,
too,
yeah.
you know? So you could even benefit from it. I wouldn't be able to get you out.
No, I keep wanting to go to the gym just to get in the pool.
So you said 60 pounds is a goal weight?
I think 60 would be a goal weight for him for sure. And
What does he weigh right now?
today he's 98 pounds.
Wish I were 98 pounds.
Hey, I'm not even 98 pounds. Don't even go there.
And with his previous knee injury, was that diagnosed with anything? Was it an ACL tear or what
It
was
was
it?
an ACL tear. The vet that, so I got him from Boulder Humane Society.
Okay.
I talked to the vet and I was like, look, I have every intention of making this dog a service dog. Is there anything that I need to know that would stop him from doing so? He was like, just so you know, he does have a previous knee injury, it's an ACL tear, that's how he came in.
Okay.
Great.
Okay.
You know?
Yeah.
So he did let us know about that. We do know that the knee can be an issue.
Yeah.
I didn't think it would be an issue for as long as it has been.
Okay. Yep. Because that's kind of my worry right now is with how much atrophy. I think it's been probably either off and on again for a long amount of time where he's not putting as much weight on it because the muscle is clearly smaller on the right side than it is on the left. So he's clearly not using it as much or putting as much weight on it. So it's not getting worked out as much. Which leads me to believe that it wasn't more of an acute thing, it was probably more of a chronic thing that's always been there. And now that might have just aggravated it more, so it's more prevalent and you guys can obviously see it. So going forward, there's kind of a few options with cranial cruciate leg tears. Ideally, rads are the first thing to rule out and make sure that there's not anything obvious that's broken or dislocated. I don't feel anything on palpation, but that's not always the slam dunk. Okay, that's fine. And then if we were to have that and it was properly diagnosed, surgery is the best option, but that's not always doable for everyone. the next best option would be kind of what you guys are already doing, which is limiting exercise, limiting everything, and then just weight loss would be ideal.
Okay.
It's never, so with the cranial cruciate ligament, it's an X that goes across their femur and their fibula, and it basically prevents their joints from going like this and just keeps them there. So if there's a tear, they start to kind of rotate and rub against each other. So that's where in surgery, what they do is they level out that bone and they make it flat, so then there's a surface for that to rub against on, and it makes it more stable. So it provides direct stability with the surgery. Without surgery, it's basically we're controlling the inflammation, we're controlling his pain, and then the joint just has to fibrose down on its own. And I don't know how, every dog is different. I don't know how he would tolerate that with the size he's at right now. Usually I would be more okay with like little chihuahuas that have that problem because they don't have a lot of weight to carry. Even at 60 pounds, that would be a lot of weight to carry on that joint that's kind of moving around. So what we could do today would be radiographs of that right hind. And then we also strongly recommend, it's an injectable joint supplement that goes to all of his joints, not just the bad one. And it's twice a week for 4 weeks injection, and then after that it's just once a month. So it won't reverse the disease, but it will slow it down, the degeneration of his joints. So that's also an option. We can get you kind of treatment plans for all of them, and we can kind of discuss what will work best for you guys. What questions can I answer after that? I know it's a lot.
Do you think, okay, so the one thing that's been bugging me, you already know about this. Do you think it's going to stop him from working?
Sorry.
Do you think it's going to stop him from working?
So I guess I don't know requirements for service dogs as far as him being able to go and do things. I mean, dogs with ACL tears go out and live their lives perfectly fine, but I think if he's obviously limping in public, that will obviously be a problem. So if we were to wanting to get him to as close back to normal as possible, I think the surgical option is going to be kind of our only option if we wanted to get him like as close back to normal as possible. And in that case, I think there's probably like a 70% chance where he could go back to work as normal and live out his daily life. But the other options and the other 30% of that option would be just keeping him comfortable and making sure that we're trying to keep as much weight off as possible.
Okay. So me and my trainer were planning after this appointment that we were gonna try to go like bigger with the weight loss.
Okay, yeah.
So I don't know what she has planned in particular.
Yeah.
But he was doing up to 45 minutes on a treadmill.
Okay.
So he was doing really good there for a while.
Yeah, for sure.
Until then, I don't know what to do to kind of help him from there.
I don't know if we can wrap the knee or anything like that.
Yeah, it's a bad spot, and dogs don't do well like humans do with braces and things. They just don't do well. So it's going to be kind of the heavier hitters of the anti-inflammatories to make sure that the knee is not inflamed and angry. And then I will love hydrotherapy for things like this, where they have achy joints. I love it. It's really nice. It's low impact. They can go a lot longer because their joints aren't on impact, but they're still getting the same amount of exercise. So if you can find, I know there's 2 places up in the Springs. That's quite a bit of a hike, and I don't know if you guys are in Florence, it looks like. It's a bit of a hike to go up there, but if you could even just get your own pool and just do it at home, that would be better than nothing. Yeah, perfect. So I think that's a fair choice. And then let me just step out and get kind of a treatment plan for all the different options I discussed, and then we can talk about them with actual numbers in front of our faces.
Okay.
Any other questions I can answer before I step out?
Do you think I should keep him on over to Aspen or no?
I don't, especially if we're gonna change him over to a different, ed said.
That makes sense.
Mm-hmm.
Yeah,
I want to do everything possible
Yeah.
for him.
for sure, yeah,
You
no,
know.
yeah,
I haven't. He's my first male dog in almost 10 years.
yeah.
My first service dog died at 11.
Oh, yeah,
The last time I was been in the vet office, he passed away.
yeah.
It took me a very long time to get another male dog.
Yeah,
And it
no, that's
worries.
fair, yeah. No, we'll get some good treatment plans together and, we'll discuss them and see what works out best for you guys and what works out best for him.
Yeah, because you and your puppy playtime.
He's just a very social boy.
That's the other thing though. He used to go out and play. He doesn't now.
No. He doesn't like his sisters being out there because Maddie's our little beagle
Beagle mix.
and she doesn't know not only personal boundaries, but she doesn't know when to stop.
Yeah, they just
So,
keep going.
Yeah, I mean, even when Maddie's, playing tug of war with Xena,
Yeah,
she lost her teeth because she didn't
Stop.
know when to stop. She just kept going.
yeah,
I think Xena had a little bit to do with that, but not. And it's only because
Xena thinks she's the alpha.
but she can be aggressive, but not aggressive at the same time.
yeah.
She can.
She
Xena
gets,
and Maddie.
she gets into what she's doing.
Yeah, she really does.
She's intense.
Oh yeah.
All right, give me a minute.
All right, sounds good. So we're gonna get you fixed, buddy.
I know. You're gonna have a surgery.
Yeah.
Let's see how much the surgery is and what the. Yeah, that's why I got you your puppy insurance so that we can have the surgery. Dad was thinking ahead. Yeah, Dad did think ahead.
He's being so good. I'm glad that spot doesn't, it's not big. Because that kind of worried me for a little bit. No, I freaking go to the bathroom and I go to wipe up the pee that ended up on the toilet and my freaking hair comes from back here and falls in. I'm just like, you son of a...
That's why I told you this morning to get a hat.
Silly me for thinking I could wear my hair down for once.
Not as long as it is.
No.
You gotta be careful with it.
Yeah.
You gotta, you have to, instead of having it all the way down like that, you have to fold it back up again, like this, and then redo it.
Yeah.
I've done that for you.
My hair ended up in the...
Yeah, now you gotta go wash it. Now Mom's gotta go wash her her hairs.
Trying to rinse it out in the sink as fast as I could, but it's still gross.
Just go
The
ahead and shower.
lady at the front desk was like, are you okay? I'm like, no, my hair ended up in the toilet.
No. And I like these people. They're not.
I'm really hoping we can avoid the whole surgery option, but I can see like
Do you have to? Do you have to? You were laying on a cold floor. Yes, I know.
He's like, I must whine that.
Why are you being whiny? Oh, you want some cheese with that?
I wanted a picture. As you guys can probably hear, we're at the vet.
Point.
Hi, kitty.
I did.
Are you good with everything so far?
Mm-hmm. Yeah, my blood sugar's starting to go up.
I know, I can tell. She's getting tired again.
Yeah, I need you.
He's just petting me, Dad. He's just petting my puppy.
Yeah, he needs a public coverage. Well, you might have to come back for surgery, mister. We don't know yet. Depends on how bad you blew it. Told you I did.
I know you did.
Alright, so things we can do today, they're working on a surgery estimate if we were to go that direction, but let's get a diagnosis first.
Yeah.
Exam, radiographs, and then I added on the senior wellness panel that will check his thyroid to see if we're hypothyroid and we're kind of upstream on weight loss things, because we could treat that, and then that would make weight loss easier. And then I just added in just one of the injections for Adequan, to let you know kind of how much it would cost. We don't have to do that today, that can be a later thing, but just so we all know what costs goes. So if you want to look at that, if you want to do all of it today, just part of it.
We're not going to be able to do that.
Not all of that today, no. Come back, I'll have to split that up.
Yeah, that's fine.
Because we're on Social
Do
Security.
you think the x-rays are like a necessity?
For surgery, they will be. The surgeon requires them prior to surgery.
Yeah. See, I was prepared for the exam and the x-rays.
Yeah.
And what we can do the exam and the x-rays today, and then if we wanted to wait a little bit, because the blood work unfortunately will also need to be before surgery to make sure he's a surgical candidate. We don't want to put him under anesthesia and have things happen because we didn't check his blood work. So that will be a requirement eventually, but it's good for 3 months once you do it. So
I mean, we could do. Because if we put the.
Because we were told, didn't you just say the x-rays and the exam?
Yeah,
That's all we were told.
right, and that's what we can just do today. I'm just giving you all the options of things that we can test for and do. We don't have to do all of that today.
Okay.
Yeah, because I would like to get him his injection. So, I mean, if we want, let's wait on the x-ray and the blood work until next visit, so that I know what I'm going to put out.
Okay, that's
and
fair.
Then we'll get his.
So with the Adequan injection, it's going to be, so there's kind of a loading dose. It would be 1 injection twice a week for 4 weeks, and then after that it would be once a month. And of course, as he loses weight, his requirement for the amount will be a little bit less as he loses weight. But just so you're aware that would be another cost at the end of the week, just the injection part of it though, not the whole exam and all the other things.
Yeah, and he does have insurance, so
Okay.
I'm not sure how much.
But the insurance said that we only had.
It's a $200 deductible on the insurance.
So just out of curiosity, I don't know if you know how this works or not. When we pay that deductible, do they cover the rest of that?
So I think for any of the insurances, you have to pay out of pocket first, and then they reimburse you. So you do have to have the money up front first, but they will reimburse you. And I'm not sure what your plan is, but based on whatever plan you signed up for, they will reimburse you for the amount. So.
Yeah, this is going to be a slow process.
Because we can't afford all of that right now.
No, and that's fine. I just wanted to lay it all on the table so you guys are aware of kind of what we're looking at.
Yeah, and I'd like to take home a copy of that so
Yeah, for sure.
I can plan plan for his stuff. Because
And if
even
you
if
guys-
we get it back, it's still gonna be a few days, you know.
What do you mean? Sorry.
Well, even if I had the money up front to pay for it, it's still gonna be a few days before they reimburse me.
Right, correct.
Because everybody's, it's amazing how slow they make it.
Yeah.
They tend to
Okay, so
make
my
it
credit
their
card company
own.
out for that too.
Always do that.
Well, they know exactly when it goes up. It tells me that within seconds of my charge. So they all know. Why does it take them 2 weeks, 3 weeks to get that processed?
It's always something. I know, it's frustrating.
It is. So, well, at least we've got the exam down. So it's gonna be $60 every visit for the shots? How's that work?
So for the shot, it will be that price, so it will be, sorry, I don't have my prices memorized, so it'd be, so it'd be this amount, for each visit that you come in and have it done.
Okay,
And that would be it.
alright,
So, and that would be twice a week for 4 weeks for the loading dose, and then after that, it's just once a month
okay.
to kind of maintain.
And you said those shots are gonna help with the weight loss too?
No, so that's just for his joints and keeping him
Oh,
lubricated
okay.
and trying to slow down the degenerative process of his disease, so.
What was the name of the disease again?
So he probably has, without radiographs, I'm not sure, but he probably has a CCL tear, or cranial cruciate ligament tear. And usually the consequence of no surgery or no treatment would be degenerative joint disease, which basically means their
Like his back.
joints degenerate over time.
Yeah. I'm a victim of that.
No, sorry, it's not a fun one.
No, it's not.
He's got degenerative disease in his back, and I've got shit like Ehlers-Danlos and stuff like that. So I totally understand
Yeah.
what he's going through.
Alright, so that's twice a week for 4 weeks?
Yes.
20, 40.
Is that something that you can do like in home, or is it like?
Yeah, so that is
required?
something we can, I don't know what cost wise, I haven't actually priced it out, but some people do, so we train them how to do it at home, and so you wouldn't have to come here and do it. The only caveat is, we still have to sell you the syringes and things, so I don't know price wise if it ends up being any cheaper or not, with us doing it versus you guys doing it, but,
Okay, so random question.
Yeah.
Here, he's diabetic,
okay.
so he
Same.
takes his insulin shots.
So those are gonna be different needles than what we use.
Okay.
So,
So
yeah,
that's
and
what-
it's gonna be
that's
a
what I was
significantly, unless you have the big 3cc syringes, which I don't think insulin syringes usually come in.
No,
So-
they're,
They're tiny.
Yeah. So he's gonna need a lot more of those.
So it's up to you, honey.
well, I'm just trying to figure out, because that ends up to be about $500 for the first month.
I know.
So I'm
And
just
we
trying
can't
to-
afford that right now.
No. So,
And I don't know if you talked to the insurance company, if you were asked them about that, if they would like upfront you the money. I don't know how it all works, and I don't know, every company's different, everyone has their own rules, but
yeah, I'll have to talk to them about it.
Maybe we should just do the x-rays and the exam, and then that'll give us a chance to talk to them, and then if they said that they can front the money up front, maybe then we can take him.
Well, and it's their policy too that they reimburse, so. Any which way you look at it, we have to front the money up front.
Yeah. And we just don't have that money right now.
No. So I'm thinking we should probably schedule him in another like 30 days or so and try and get the x-ray and blood work done.
Because we're gonna have to do this, and
yeah, no,
Yeah.
that's totally, I wanna be respectful of your financial situation, and I totally understand that everything is not cheap right now. It hasn't been for a while, so
No.
it's
the
ridiculous.
problem comes in when you're on Social Security. Social Security doesn't pay you enough to even live, like,
Yeah.
you know, like
I can
Under the
make
poverty
more
line.
at McDonald's as a burger flipper than I can on Social Security
Right, yeah,
because
So
we're not
it's-
even getting minimum wage.
right, yeah.
We're below poverty level right now.
Oh yeah, well,
And they keep talking about raising it and shit like that, and I'm just like, yeah, when it lands right there, then I'll believe you. Until then, go away.
oh yeah, they've been spouting all these wonderful numbers, and I'm just like,
Stop spouting and actually put it in my bank account.
So yeah,
That would help.
So what would we like to do today? Or do we wanna wait on everything and then kind of
I would
budget for it?
I would like to wait and budget for
Okay.
it and get him another appointment.
Okay,
First of next month or so.
perfect, that sounds like a plan.
That way-
You can take this home.
Yeah, that way I can figure out what I can do with it.
There we are, and then it'll just be the exam today then, so that's all, and then, we'll chat more next month, and you guys have a better idea about what's kind of,
Yeah, but at least now she's not gonna worry about whether she's gonna lose him or
right.
have him out of service or any of that.
I've been in tears
Oh, I'm so
since my
sorry.
trainer pulled him out of PA.
Yeah.
Let me see. Huggy's over here booping snoots. What'd you do?
I went, boop.
Stop yelling, dude. There's this guy over here who keeps yelling. I don't know if it's God bless you or bless you. That's what he keeps yelling. So, the general gist of the appointment, do tell. And part of the reason I'm having you tell it is because I didn't understand half of what she was saying.
Well, the general gist of it is they need to get,
That doesn't sound good.
they need to get x-rays and blood work done because they want to make sure that his thyroid's good. They want to make sure his kidneys and stuff are good. And then the other part of it is the x-rays to make sure to see what's going on with that leg.
So, it's still kind of up in the air, but you guys heard it. I asked her blunt and straightforward. I was like, hey, do you think I'm going to lose my dog over this? And she was like, well, yes and no, is what I understood. So, I don't know. We are going to see about doing water therapy. Me and my trainer were already talking about doing that. But we need to get a pool that is big enough in order for everybody to,
Yeah.
in order for everybody to benefit from it, we need to get the pool that is big enough. So, I'm going to go through my trainer's text messages and see if I can find those pools again. I think I sent them to you, didn't I?
I don't know.
I don't know. Anyway, that's the appointment. I love you guys, and I hope you guys are having a good day. Bye, guys. Let's say goodbye.
Bye.
Ugh.